Good evening, everybody. I am Dr. Niranjan Kumar Sringeri talking to you today from Sringeri regarding ECG. Today's subject is ECG made easy for Ayush friends. Make it very clear. Please target spectators or listeners or Ayush doctors who are my classmates, friends, students, all etc. Now, why Ayush doctors should know ECG? It's a general observation that in Ayush colleges, ECG is not taught. So, when they come out of the Ayurveda colleges, many students find it very difficult to read ECG and they find it very inferior when they work with some allopathy doctors. And Ayush doctors should know ECG also. It's my opinion. See, when a case of chest pain comes, you can't say, I don't know. You should be able to read ECG. So, this was my long time ambition to teach Ayush doctors who don't know ECG. There are many people who know ECG, who don't know ECG, to be familiar with ECG and to make them familiar with ECGs and make them more confident when the cases come. To introduce myself, I am Dr. Niranjan Kumar, a private practitioner at Sringeri. As a, I did my BAMS from Udupi Ayurveda College, then short-term course in modern medicine from Bangalore University at KC General Hospital. I did my post-graduation in hospital and health system management and masters in counseling and psychotherapy. I have got a vast experience, clinical experience, not boasting myself. I have worked in Sringeri Mutt, Sharada Dhanvantari Charitable Hospital for 20 years. I was sent to Manipal KMC for training in anesthesia. I have given anesthesia to more than 7,000 operations without fail. I have trained more than 35 batches of nursing students. Most of them are employed in Narayana Hrudayalaya, Rangadore Hospital and various hospitals in Chikmagalur, Shimoga, Bangalore and South Kannada districts. This is my brief introduction. So let us come to the subject matter of today, ECG. What is ECG? ECG means electrocardiogram. What is ECG record? ECG record means electrocardiographic record. Now, what are the principles of ECG? ECG important principles. ECG is easy to understand. All the changes in ECG are amenable to reason. You have to give reason why it has happened in ECG like this, like that, and all. So ECG is not very difficult. Now, many my Ayurveda friends feel that ECG is very difficult to learn. Don't think like that. It is very easy to understand. ECG is very easy to understand. In some countries, instead of ECG, it is also called EKG, not ECG, EKG. ECG record means electrocardiographic record. ECG means electrocardiogram. Now, all of you have got heart, I suppose. Have you given your heart to anybody? No. Even in students' life also. Okay, let us have a brief look at the heart. This is the vertical section of heart. We have got right auricle, left auricle, right ventricle, left ventricle, pericardium, inferior vena cava, superior vena cava, pulmonary arteries, aorta and pulmonary veins, and bicuspid wall and tricuspid wall. Though heart has got four chambers, from ECG point of view, it is considered as made up of only auricles and ventricles. Auricles and ventricles. Now, what is ECG is going to do? ECG is going to record the electrical changes that take place in heart muscles. The flow of electricity pattern is recorded by ECG. It doesn't say how efficient your heart pumps. Now, for any muscle to contract, there should be some flow of electricity. Likewise, in heart muscles also, there is a flow of electricity. The changes in electricity are recorded by ECG machines. Okay, now when we should take ECG? ECG is taken when there is chest pain, when there is exertional dyspnea. See, in many times in clinical practice, we come across breathlessness or difficulty in breathing or asthma. The first question you should ask is whether the patient is a non asthmatic or not a non asthmatic. If he is a not a non asthmatic, then ECG is a must. Where else you should take ECG? Palpitation, syncopal attack, and unconsciousness, and sometimes epigastric pain. Many times, epigastric pains are due to MIs. This is one misleading clinical observation. Many times, doctors miss epigastric pain. They fail to take ECG and the patient collapses when he goes out of the clinic. This is very, very important. All Ayush doctors should know that in any epigastric pain coming for the first time, you should take an ECG. This is a must. And BP recording, pulse reading, and all. Now, let us see, as I told you, that flow of electricity. Now, let us see the electrical diagram of the heart. Look at this picture. Can you see? Yes. There is a specialized tissue called sinoatrial node. From there, in the right auricle, from there, electricity flows towards AV node, which is at the junction of the atrium and ventricle. From there, it goes through the bundle of his, and then bundle of his divides into right bundle branch and left bundle branch, and then the flow of electricity spreads through the ventricles through specialized cells, specialized called Purkinje fibers. Now, this flow of electricity is very important to know whether the heart is working properly or not. That's why ECG is taken. Now look at this picture. ECG. There are 12 leads in ECG. If you look at the ECG record, you will see AVR, AVL, first, second, third, and AVF, like this. This picture always should be in your mind to know the electricity flow of ECG. Now these AVR, AVL, first, second, third, and AVF are all called limb leads. Limb leads. Limb leads is the plane of direction of the seeing of heart from different views. It is always confused with electrodes. Electrodes are not leads. Now you will see AVR looks at the right auricle, AVL looks at the left auricle and left side of the heart. First also looks at the lateral side of the heart. And third and AVF look at the downside of the heart, and second at the right ventricle. Now, and there are chest leads. They are called V1, V2, V3, V4, V5, and V6. V1 and V2 look at the right ventricle. V3, V4 look at the septum. V5, V6 look at the left ventricle in a horizontal manner. This is, you should always remember this picture from where, then you will come to know in which part of the heart some damage has occurred when the ECG is taken. You should always keep in your mind how to remember. Opposite of AVR is always second. Third and AVF look at the bottom of the heart. First and AVL look at the left lateral side, and AVR looks at the right auricle. Now, in ECG, you have many waves. The first, this is called the baseline or isoelectric line. The first upward deflection is called P wave. The first downward deflection is called Q wave. Then comes the R wave. Then comes the S wave. Then the T is suggestive of resting position of the heart muscles, that is, after depolarization it once again comes back to repolarization. Mhm. Then there is one U wave which is uncommon after T, sometimes in electrolyte imbalances. You see, if U wave is seen after T wave, then it is not abnormal, but after flattened T wave, if U wave is seen, then it is abnormal. Once again, you see, this is the Q wave, this is the R wave, this is the Q wave, R wave, or yes, like this. You should always know the first downward deflection is called Q wave, followed by R wave, S wave, and T wave. Now, if you look at the ECG, you will see large squares